you'd like a detailed, expanded version of your insomnia report covering all 19 sections comprehensively. Below is a fully elaborated version ideal for a nursing, psychology, or medical report, college level or above. And 1. Introduction. Sleep is a fundamental biological process vital for physical restoration, cognitive function, and emotional stability. During sleep, the body repairs tissues, consolidates memories, and regulates hormones. When this natural cycle is disrupted, it leads to various sleep disorders, the most prevalent being insomnia. Insomnia is not simply a lack of sleep, but a persistent difficulty with sleep initiation, maintenance, or quality, despite adequate opportunity and circumstances for sleep. It can significantly affect a person's daily functioning, leading to fatigue, irritability, poor concentration, and reduced productivity. In the modern world, the prevalence of insomnia is increasing due to high stress levels, irregular work schedules, and unhealthy lifestyle habits. Understanding its causes, risk factors, and management strategies is essential for healthcare professionals to provide effective care and improve patient outcomes. 2. Definition. Insomnia is defined as a subjective complaint of inadequate or poor quality sleep, characterized by difficulty in initiating or maintaining sleep, or experiencing non-restorative sleep, leading to daytime impairments such as fatigue, poor concentration, and mood disturbances. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, insomnia disorder is diagnosed when the symptoms occur at least 3 nights per week for at least 3 months and cause significant distress or impairment in social, occupational, or other areas of functioning. Schemmer 3. Etymology. The term insomnia is derived from the Latin words in equals not, somnus equals sleep. Therefore, insomnia literally translates to no sleep or sleeplessness. Historically, references to sleeplessness appear in ancient medical texts, but the modern understanding of insomnia as a disorder emerged in the late 19th and early 20th centuries with the rise of sleep medicine. Number 4, epidemiology. The global prevalence of insomnia symptoms is estimated at 30 to 40%, with 10 to 15% meeting diagnostic criteria for chronic insomnia. Women are 1.5 to 2 times more likely to experience insomnia than men, partly due to hormonal fluctuations during menstruation, pregnancy, and menopause. Older adults have higher rates of insomnia due to medical comorbidities, medication use, and changes in circadian rhythm. Adolescents and shift workers are also at increased risk due to lifestyle and environmental disruptions. Chronic insomnia is often comorbid with psychiatric disorders, especially depression and anxiety, and medical conditions such as hypertension, chronic pain, and diabetes. Number 5. Types of insomnia. Insomnia can be classified in several ways. A. Based on duration. 1. Transient insomnia lasts for less than 1 week, often caused by temporary stress or environmental factors. 2. Short-term acute insomnia persists for 1 to 3 weeks, usually triggered by stress, illness, or significant life events. 3. Chronic insomnia occurs at least 3 nights per week for 3 months or longer, often associated with underlying psychological or medical conditions. B. Based on sleep pattern. 1. Onset insomnia, difficulty falling asleep at the beginning of the night. 2. Maintenance insomnia, difficulty staying asleep or frequent awakenings. 3. Terminal late insomnia, early morning awakenings with inability to return to sleep. C. Based on cause 1, primary insomnia, not attributable to any other condition or substance. 2. Secondary, comorbid insomnia, occurs due to other medical, psychiatric, or environmental factors. Number 6. Causes of insomnia. Insomnia can result from multiple interacting factors: psychological, stress, anxiety, depression, grief, trauma; physiological, pain, hormonal imbalance, hyperthyroidism, menopause; environmental, noise, light, uncomfortable temperature, irregular work shifts; lifestyle-related, caffeine or alcohol use, late-night screen exposure, irregular sleep schedule; pharmacological, medications such as stimulants, corticosteroids, antidepressants; behavioral, poor sleep hygiene, excessive daytime napping, or worry about sleep itself. Number 7. Risk factors: female gender, increasing age, mental health disorders, anxiety, depression, chronic medical illnesses, asthma, diabetes, chronic pain; stressful life events, substance use, alcohol, nicotine, caffeine; shift work or jet lag; family history of insomnia; sedentary lifestyle and irregular routines. 8. Complications. If untreated, insomnia can lead to numerous physical, psychological, and social consequences. Chronic fatigue and decreased alertness, reduced concentration and memory impairment, increased risk of accidents and injuries, emotional instability, irritability, and depression, weakened immune response, weight gain and metabolic syndrome, cardiovascular diseases, hypertension, heart disease, poor work or academic performance, strained interpersonal relationships. Number 9, pathophysiology. The pathophysiology of insomnia involves hyperarousal of the central nervous system, dysregulation of circadian rhythms, and neurotransmitter imbalance. A. Neurobiological mechanisms. Hyperarousal hypothesis. People with insomnia show elevated metabolic and physiological activity even during sleep. Neurotransmitter imbalance. Low GABA, inhibitory neurotransmitter, and high levels of norepinephrine, serotonin, and dopamine may contribute to wakefulness. HPA axis activation. Chronic stress increases cortisol secretion, which delays sleep onset and reduces deep sleep. B. Circadian dysregulation. Disruption in melatonin secretion and light exposure affects the body's internal clock, leading to poor sleep timing and quality. Number 10. Stages of sleep. Normal sleep progresses through NREM, non-rapid eye movement, and REM, rapid eye movement stages in 90-minute cycles. 1. NREM Stage 1, light sleep, transition between wakefulness and sleep. 2. NREM Stage 2, true sleep, reduced heart rate and body temperature. 3. NREM Stage 3, deep sleep, slow wave sleep, physical restoration occurs. 4. REM sleep, active brain, vivid dreams, essential for memory and learning. In insomnia, individuals experience prolonged Stage 1, frequent awakenings, and reduced deep and REM sleep. Signs and symptoms: difficulty falling or staying asleep, waking too early in the morning, non-restorative sleep, daytime tiredness or fatigue, poor attention, concentration, or memory, mood disturbances, irritability, anxiety, depression, headache or gastrointestinal upset, decreased performance at work or school. Number 12. Medical diagnosis. Diagnosis is primarily clinical, supported by diagnostic tools, sleep history, assessment of bedtime habits, sleep duration, and lifestyle factors, sleep diary, record of sleep and wake patterns over 2 weeks, polysomnography, PSG, overnight sleep study measuring brain waves, oxygen levels, heart rate, and movements, actigraphy, wrist-worn device recording sleep-wake cycles, insomnia severity index, ISI, questionnaire assessing symptom severity, screening for comorbidities, depression, anxiety, or medical illnesses. Number 13, nursing diagnosis. 1. Disturbed sleep pattern related to environmental disruption or stress. 2. Fatigue related to inadequate sleep. 3. Anxiety related to inability to fall asleep. 4. Impaired concentration related to prolonged wakefulness. Risk for injury related to daytime drowsiness or poor alertness. Number 14, medical management. Pharmacologic therapy. Benzodiazepines, e.g. temazepam, lorazepam, short-term relief. Non-benzodiazepine hypnotics, e.g. zolpidem, zaloplan, melatonin receptor agonists, Ramelteon, antidepressants, trazodone, doxepin for comorbid depression, antihistamines for mild cases, though not preferred long-term. Non-pharmacologic approaches, cognitive behavioral therapy for insomnia, CBTI, relaxation therapy and meditation, sleep hygiene education. Number 15, nursing management. Assess and document sleep patterns and contributing factors. Educate patient about maintaining consistent sleep and wake times. Encourage a relaxing pre-sleep routine, reading, warm bath. Limit caffeine, nicotine, and heavy meals before bedtime. Ensure the sleep environment is quiet, dark, and comfortable. Teach relaxation techniques, deep breathing, guided imagery. Monitor response to medications and side effects. Promote stress management through counseling and support. Number 16, treatment options. Cognitive behavioral therapy for insomnia, CBTI. First-line treatment focuses on changing maladaptive sleep beliefs. Sleep hygiene therapy, lifestyle modification for better sleep habits. Relaxation training, deep breathing, meditation, progressive muscle relaxation. Stimulus control therapy reinforces the association between bed and sleep only. Pharmacotherapy, used short-term in severe or resistant cases. Complementary therapies, yoga, aromatherapy, acupuncture. Number 17, psychosocial interventions, 5 examples. 1. Cognitive behavioral therapy, CBTI, identifies and changes dysfunctional sleep-related thoughts and behaviors. 2. Mindfulness meditation, enhances relaxation and reduces nighttime anxiety. 3. Stress management counseling teaches coping mechanisms for stress reduction. 4. Support groups provide social support and shared coping strategies. 5. Lifestyle modification programs encourage physical activity, relaxation, and balanced routines. 18. Prevention. Maintain regular sleep and wake times. Avoid caffeine, nicotine, and alcohol in the evening. Create a calm and comfortable sleep environment. Limit daytime naps. Engage in daily exercise but not close to bedtime. Manage stress through relaxation and mindfulness practices. Avoid using electronic devices before sleep. Number 19. Conclusion. Insomnia is a multifactorial disorder that significantly impacts health and quality of life. Although it is common, it often remains undiagnosed and untreated. Comprehensive management, including behavioral therapy, lifestyle modification, and when necessary, pharmacologic intervention, can yield excellent outcomes. Nurses play a crucial role in patient education, assessment, and support. Promoting good sleep hygiene and stress management can prevent insomnia and enhance overall well-being. Thank you. Have a nice day.